Welcome back. Imagine your family member is hospitalized, they're recovering well, until suddenly they don't recognize you. They're confused, agitated, or seeing things that aren't there. It's known as hospital delirium, and it can rapidly develop. Dr. Ray, what causes this sudden confusion, and why is it so hard to recognize?
Well, it's hard to recognize because I think a lot of medical professionals in the hospital, nurses and all that, they don't recognize that entity, and they figure that this person has dementia or so, or maybe they're just depressed and all that, and it's totally different. It usually is triggered by some kind of a medical condition or so. So you really have to look for the underlying things like maybe infection or even simple things like dehydration, constipation, urinary retention, medications, or even side effects from medications. You want to really look at that. But the other thing I think that confuses people, because it's so acute, you also have to differentiate that from a stroke. Now that would be legitimate. And so one of the ways that you can look at that is with delirium, it lasts for a little bit and then it resolves. But a stroke, you're going to have continued symptoms going on. It's not going to fluctuate. And I think you really have to look at it as if the brain is kind of like a GPS system. Really, it's a GPS system. It's active. Destination hasn't changed, right?
Okay.
It has clear direction. But what if you have a storm that comes in and disrupts the signal? But then eventually you get the signal back.
That's a great analogy.
Okay. So I do have to add that there are some that aren't physical causes.
Sure.
So loss of sleep. When you're in a hospital, how well do you sleep?
As a resident,
yeah, that sleep deprivation is big time. And then sensory, over-sensory.
load.
So all the bells and whistles and the alarms and people coming in your door and out your door, and if you've got a shared room, and that person may have people coming in and out. So that sensory issue that goes on, and then you're in a totally new environment. And so that transfer part of the hospital delirium is very real.
I think the rule of thumb for anybody that's in the hospital, try if you can not to be alone. Always have someone there with
Agreed.
you.
Yeah.
And expect hospital delirium to occur. The statistics are high, the percentages are high that it happens frequently. And think practically, like hearing aids, do they have them in? Glasses, are they wearing them?
Right.
Do they have the water pitcher near them, or is it all the way across the room? So keep them hydrated, and the minute you see something, bring someone in to get it evaluated so that it doesn't continue.
Keep things as familiar as you can in an unfamiliar environment.
And that's going to pay off when your doctor really knows you and you have family and friends around, so they can let people know that something's not right.